There's no question that some people have had a very good experience with the ACA, with Obamacare, but most people have had a very bad experience with it. The point is, the American people have made it very clear they want Obamacare repealed. We're going to be judged on our ability to deliver a vastly better health care system to the vast majority of Americans.
That is California Congressman Tom McClintock, one of the many Republicans facing angry constituents this week amid growing concern over what will replace Obamacare. For more on this, let's bring in Dr. Marc Siegel. He's a member of the Fox News Medical Aid Team and professor of medicine at NYU Langone Medical Center. Doctor, good to have you here.
Great to see you, Abby.
This is such an emotional issue and nothing more important than health care. Advice that you have for the administration and Republican lawmakers on this transition, as they say they are working to repeal and replace Obamacare. How do they get this right so people are not living in fear?
Key word is fear. And as a practicing physician, I would tell everyone out there, this needs to be done in a way where you're not afraid of getting sick, where you're not afraid of losing your coverage, not afraid of dying. 22 million people cannot lose their insurance right away. But this is happening because Obamacare is not working in my office or in any doctor's office in the country. It's too clunky. It covers too much. It's too ambitious. Patients have a sense of entitlement. They get in there. They've got problems not knowing a deductible is kicking in. I call it deductible transparency. Where'd that come from? I'm paying out of pocket for this suddenly. And patients are already angry from Obamacare. The key is transition it in a way where you keep some of the popular things. Pre-existing conditions. People that are very sick have to have coverage. We cannot take that away. Children that are graduating college that want to stay on their parents' policy. Haven't you known, struggling young adults? It's a great provision.
So many of them, doctor. So many. That's such an important issue. The other part of this, too, and I've traveled the country talking to small business owners, and it is really heartbreaking when you hear their stories. They either can't expand their business or they lose it altogether because they can't afford it with Obamacare. So what can they do as part of this plan to help the economy, to help these small business owners do what they do best?
Well, the key is to not let Obamacare parasitize the whole system. I've noticed, I work for an employer, I've noticed that employer-based insurance is changing now. Bigger deductibles we didn't know about, less choice. President Trump has talked about adding more choice. Here's what that means. It means that the best mammographer in town, Abby, is somebody that doesn't take insurance at all. And I know that, and I struggle to send my patient to somebody that I don't think is as good. That's very hard for me as a physician. Or the insurance only covers one lab, and I know that that lab does a terrible job on glucoses. And I'm looking at a diabetic, and I'm saying, wait a minute, I got to send a diabetic to that lab? Now, insurance
my sister has type 1 diabetes. I cannot tell you what she has gone through. It has become so complicated.
Well,
but
the doctor doesn't take it, right?
That's true. But what about competition? I mean, isn't that key here, too, to make sure that the prices, the quality and the prices go down? And that is allowing people maybe to cross state borders to find a better plan.
So that's a great point. And I also want to reassure people out there that's got to be a transition. This isn't about collapsing the state exchanges. It's about working towards a national marketplace. Again, as President Trump has said, insurance across state lines, that's not going to happen overnight. We need to repeal the 1945 law. We have to slowly create a national marketplace. It makes total sense that if insurance is cheaper in Nevada, I ought to be able to buy it here, use it in Nevada. All of that competition is going to bring down price. One of the biggest criticisms of Obamacare is that 1 out of 3 counties, Abby, have only one provider. One provider staying in. Now, Humana is going out. It is not working for insurers, and it is not working for patients. I'll tell you one thing, not working for doctors. We have a doctor shortage. We need malpractice reform. We're glad that doctors are glad this is being repealed.
All such great points, Dr. Siegel. Nothing more important than our health care. They've got to get this one right.
And we got to do it without making them afraid.
Yep, spot on. Bill?
Thanks.